Number one is exercise and weight loss, because the knee is under a lot of stress when we get out of a chair, when we go upstairs, or if we run or even walk fast. Some of the forces are 10 times the body weight. So losing 1 pound is like losing 10 pounds to the knee joint in a lot of stressful situations. So weight loss, it doesn't have to be a lot to make a significant difference. Regular exercise is also important. A joint that's moving usually has less symptoms. So if we can keep the joints moving on a regular basis, patients will do better. Patients that I've seen live with arthritis and have a normal life and lifestyle and a healthy lifestyle usually are thin and usually exercise every day where the knee is being used. The worst model is somebody that just uses it on a trip or a big hike and is really not prepared for it. Then the joint's usually going to react. There's going to be increased inflammation, increased destructive properties will occur, and that'll set the patient back. So they'll go from one bad episode to another bad episode, and it's much better to do regular exercise. So after exercise and weight loss, then there's other modalities such as meds that we call nonsteroidal anti-inflammatory drugs. The problem with those is that they recently or in the near future are going to all have a label that there's cardiac or heart risk with them. The problem's not that well understood, but certainly there's enough information that it is a concern, and it's not, when we take these meds, even though a lot of them are over the counter, you have to understand that you better have a good reason because there are potential complications with them. After we go from meds by mouth, and we start thinking about injections. And with injections, we have the potential to decrease inflammation. We also have the potential to help thicken the fluid and provide some healing properties or decrease inflammation around the joint. Again, these are temporary measures. There's potential side effects with all treatment options, and certainly with injections there are as well. And the other thing to remember is that they're not going to make the knee joint normal, but hopefully help with symptoms. Then the final treatment is going to be to replace what's missing, and that's either going to be a partial knee replacement where there's just a specific area that has a problem, or most of the time it's more involved and the whole surface needs to be replaced. Bracing works by applying more stress to the good side of the knee. So typically by development or by injury pattern or by just the way that we stress the knee, one side's going to wear faster than the other side. And that side that's worn can be helped by a brace that's going to apply a tension force and put more stress on the good side. The problem with a brace often is that it's not that comfortable, that it ends up in the closet. So it's not everybody that's going to benefit from a brace, but it's certainly an option that there's not any risk with it. Just the risk that it's not going to help, the risk that it's not going to be used are the biggest issues. But it can be helpful and prolong the patient's time period in which they don't address the problem with surgery.